It is often called the silent thief of sight. Glaucoma is the leading cause of blindness in the U.S., but nearly 50% of people don't even know they have it until it's too late. So here to talk with us about it today is Dr. Kimberly Orr. So let's just kind of do the 101. What is glaucoma?
Yeah, so glaucoma is a disease of the optic nerve inside the eye. It happens when the pressure inside the eye is too high, and that damages the optic nerve. And the damage to the optic nerve takes the peripheral vision or your side vision slowly over time. And there's not a lot of symptoms with it. That's when you mentioned the silent, sneaky stealer of vision. It does kind of sneak up on people because they won't have any pain or anything or have very significant symptoms until it's very far progressed.
Okay, and when it's far progressed, you can actually tell that someone has glaucoma by looking at their eyes. I think we have a video
Yes.
of what glaucoma looks like. And
Hmm.
so you see the normal eyes on one side of your screen, you see the glaucoma eyes on the other side.
Yes. Yes.
So
And so,
what does that
yeah.
normally, it's like a shading almost.
Yeah, and that actually that picture may be cataracts. Actually, I can't see it too easily, but the glaucoma is actually inside to the back part of the eye with the optic nerve.
But you're able to see it though from the front when you're looking at someone when it's progressed.
Well, another person couldn't see it. Only an optometrist will be able to see it inside the eye.
Gotcha.
Hmm.
And so
Yeah.
how do we know then if it's that silent stealer and you said that we don't have any symptoms, then all of a sudden our peripheral vision starts getting, more and more
Yeah.
creeps in, then what's the only way to know that we have it?
That's a great question. So, the only way to know is to get an eye exam. And so, we always recommend that people get an eye exam once a year, even if they feel that their vision is fine, because they might not know that they have risk factors for glaucoma, like elevated eye pressure. They might have early loss of side vision that's not really impacting their day to day activities. And they might not know that they have it. So, we want to have people come in once a year to check on those things.
Yeah, it's just once a year, the regular eye exam. There's no special exam that needs to be done for that.
Uh, no, not we can screen for it at an annual exam if we find risk factors or things that are, concerning for us, where we believe that glaucoma may be there or may be a condition that somebody has, and we can bring them back for extra testing to confirm if they need treatment.
Besides having our regular eye exam, which is something that is basic and something that, is on people's to-do list, is there something else that we can do to prevent glaucoma?
You know, a lot of times it is a genetic condition, and so there aren't really things that you can do other than getting your eyes checked. There are some secondary glaucomas that can be a result of trauma. So if you've had a history of head trauma, making sure that that pressure isn't elevated years later is really important. But I always tell people to take care of your body from the inside out, making sure that blood pressure's under control, blood sugar's under control. There are certain conditions, or certain things that can happen secondary to those conditions that can cause the eye pressure to elevate as well. So you want to make sure that you're taking care of your body from the inside out.
All right, and just because it's a sunny day, I'm going to ask this question. How important are
Yeah.
sunglasses?
Yeah, sunglasses are so important. The skin around the eye is very thin, and people can get skin cancers along the eyelids. Cataracts can develop more quickly with UV exposure. And so, wearing sunglasses when you're outside, you want to make sure it's 100% UVA and UVB protection.
Okay, it's not just a fashion thing, it's a medical thing. You need to be wearing those sunglasses. Dr. Orr, thank you so much for your time and your expertise.
Thank
If you need to
you.
listen to this, maybe send this to someone that you think needs to hear this, that needs to go and have their eyes checked once a year. This is going to be in the Two Wants to Know section of our website. We'll be right back.